In the heart of the Middle East, a microscopic organism is quietly impacting the health of millions. This is the story of Helicobacter pylori, or H. pylori, a bacterium that has found a home in the stomachs of a significant portion of Jordan's population. It's an issue that often goes unnoticed, overshadowed by more immediate health crises. Yet, its presence is a persistent public health challenge. The high prevalence rates in the country mean that countless individuals are living with a potential threat inside them. This isn't just a concern for those who feel sick, it's a national health issue that demands our attention and understanding. Why should we be so concerned about this particular bacterium in Jordan? The answer lies in its potential to cause serious long-term harm. For many, an H. pylori infection might not cause any symptoms for years, allowing it to silently damage the stomach lining. This hidden activity is what makes it so dangerous. It can lead to chronic inflammation, painful ulcers, and in some cases even stomach cancer. In a country known for its hospitality and communal dining, the very customs that bring people together can also contribute to the spread of this infection. The public health implications for Jordan are substantial. The high number of infections places a heavy burden on the nation's healthcare system. Doctors and clinics are frequently visited by patients suffering from stomach pain, bloating, and other digestive issues, many of which are rooted in H. pylori. So what exactly is this organism that causes so much trouble? Helicobacter pylori is a fascinating and resilient bacterium. It has a unique spiral or helical shape which allows it to corkscrew its way through the thick mucus layer that protects the stomach lining. This is a crucial survival mechanism. Unlike most other bacteria which cannot survive the stomach's incredibly acidic environment, H. pylori is specially adapted to thrive there. It is classified as a gram-negative bacterium, a detail that is important for scientists and doctors when they are deciding which antibiotics will be most effective. One of the most remarkable features of H. pylori is its ability to produce a powerful enzyme called urease. This enzyme is its secret weapon for survival. Urease converts urea, a substance naturally found in the stomach, into ammonia. This ammonia neutralizes the stomach acid in the immediate vicinity of the bacterium, creating a small, less acidic cloud for it to live in. This clever trick allows H. pylori to establish a long-term residence in what would otherwise be a deadly environment. The transmission of H. pylori is closely linked to living conditions and hygiene. The primary routes of infection are believed to be oral-oral and fecal-oral. This means it can spread from person to person through direct contact with saliva, such as by sharing utensils or through kissing. It can also be transmitted through the consumption of food or water that has been contaminated with fecal matter. The sharing of food from common plates, a cherished cultural practice in Jordan and many other places, can inadvertently become a pathway for the bacterium. Once H. pylori has successfully colonized the stomach, it begins a slow process of causing harm. The most common condition it causes is chronic gastritis, which is a persistent inflammation of the stomach lining. For many individuals, this gastritis may produce only mild symptoms such as bloating, nausea, or a dull ache in the upper abdomen. Because these symptoms are so common and can be caused by many different things, people often dismiss them as simple indigestion. However, this ongoing inflammation is the foundation for more serious diseases, gradually weakening the stomach's natural defenses over many years. This chronic inflammation can eventually lead to the formation of peptic ulcers. These are painful sores that develop on the lining of the stomach or the duodenum, which is the first part of the small intestine. H. pylori is responsible for the vast majority of these ulcers. The bacterium disrupts the protective mucus layer, allowing harsh stomach acid to come into direct contact with the sensitive tissue underneath. Beyond gastritis and ulcers, the most frightening potential consequence is an increased risk of developing certain types of stomach cancer. Specifically, it is a major risk factor for gastric adenocarcinoma and a rarer cancer called malt lymphoma. The chronic inflammation triggered by the bacterium can cause changes in the cells of the stomach lining over decades. While only a small percentage of infected individuals will go on to develop cancer, the high prevalence of H. pylori in places like Jordan means that the overall number of cases is significant. When a patient comes to a doctor with persistent stomach problems, and H. pylori is suspected, there are several reliable methods for confirming its presence. One of the most common and non-invasive tests is the urea breath test. For this test, the patient drinks a special liquid containing a substance called urea. If H. pylori is present in the stomach, its urease enzyme will break down this urea, releasing carbon dioxide that is tagged with a special marker. This marked carbon dioxide is absorbed into the bloodstream, travels to the lungs, and is then exhaled. Another straightforward and non-invasive diagnostic tool is the stool antigen test. This test checks for the presence of H. pylori proteins or antigens in a stool sample. It is a very accurate method for detecting an active infection and is often used both for initial diagnosis and to confirm successful treatment. For more complex cases, or when there is a suspicion of ulcers or cancer, doctors may recommend an upper endoscopy. During this procedure, a thin, flexible tube with a camera on the end is passed down the throat into the esophagus, stomach, and duodenum. Once H. pylori is diagnosed, the standard treatment is a powerful combination of medications. This usually involves a triple therapy regimen consisting of 2 different antibiotics to kill the bacteria and a proton pump inhibitor, or PPI. The PPI reduces the amount of acid produced by the stomach, which not only helps alleviate symptoms like heartburn, but also creates a less acidic environment, helping the antibiotics work more effectively. It is crucial for patients to take the full course of medication exactly as prescribed to ensure the infection is completely cleared. While effective treatments exist, the ultimate goal is to prevent H. pylori infection from occurring in the first place. The foundation of prevention is rooted in public health fundamentals, hygiene and sanitation. Promoting frequent and thorough hand washing, especially after using the bathroom and before preparing or eating food, is one of the most effective personal measures an individual can take. On a community level, ensuring access to clean, safe drinking water and improving sanitation systems are critical steps. Raising public awareness is another key pillar of prevention and early detection. Educational campaigns can inform people in Jordan about what H. pylori is, how it spreads, and the symptoms it can cause. When people understand that their persistent stomach pain might be more than just indigestion, they are more likely to seek medical advice early. For certain populations, especially those with a family history of stomach cancer or other significant risk factors, screening for H. pylori can be a valuable preventive tool. Identifying and treating the infection in asymptomatic individuals can stop the long-term inflammatory process before it leads to more severe conditions. In conclusion, the